Hello, my name is Sarah Johnson. I'm a research associate at the University of Utah. Today, I'll be talking about FUS and anti-PD-1 immunotherapy in a triple-negative breast cancer mouse model. I'd like to start off this talk by thanking my own immune system for protecting me from the dangerous pollen outside. It's definitely working overtime considering how congested I am, so I will try to enunciate as much as possible throughout this talk. Anti-PD-1 checkpoint inhibitors are a form of immunotherapy, which is FDA approved for several cancer types and is part of the standard of care for some metastatic triple-negative breast cancers. TNBC is a promising candidate for anti-PD-1 immunotherapy since there is a PD-L1 positive patient subset, and TNBC is relatively immunogenic for breast cancers. However, overall response rates in clinical trials have been modest, around 22% for immunotherapies. As many in this community are aware, there is preclinical evidence that FUS thermal ablation in combination with immunotherapy can generate a potent anti-tumor adaptive immune response, specifically by increasing T-cell recruitment to the tumor. To give a brief review of the PD-1-PD-L1 axis, T-cells in the tumor microenvironment become activated when a tumor antigen is recognized as atypical and is presented to the T-cell. PD-1 upregulation by activated T-cells serves as a checkpoint on T-cell immunity, since the T-cells often become exhausted when PD-1 binds to its ligand PD-L1 on tumor cells. In this way, the tumor disguises itself as normal and evades the immune system. On the other hand, anti-PD-1 drug blocks this interaction, so T-cells can undergo clonal expansion and induce tumor cytotoxicity. Therefore, anti-PD-1 can be said to take the brakes off the immune system, and synergistically, FUS can provide the gas by increasing tumor-infiltrating T-cells. To investigate FUS combination therapy, we implemented an orthotopic TNBC model in 32 FEB background female mice. Once tumor diameters reached about 1 centimeter, mice were assigned to a control, a PD-1 only, a FUS only, or a combination group. For a 14-day treatment schedule, mice were administered by anti-PD-1 by IP injection on every third day, and FUS or sham was administered once on day 3. On day 15, mice were euthanized and tumor tissues were harvested for flow cytometry and immunophenotyping. The FUS ablations were performed under MR guidance in a 3T magnet using a 3 megahertz small animal annular array. We targeted ablation temperatures of about 65 degrees C and about 50% of tumor ablation. With real-time 3D MR thermometry, we were able to achieve repeatable dense and sparse ablation patterns by altering the sonication parameters as listed below. So over the course of the 14-day treatment, the FUS combination groups saw the greatest reduction in tumor growth. Additionally, mice that received FUS-dense combination therapy had significantly reduced tumor growth and significantly increased CD8 positive T cells compared to the FUS-dense monotherapy group. However, at this 14-day endpoint, there was not a significant difference in total TILs and tumor-infiltrating B cells across groups. Interestingly, we observed a 1.5 to 3-fold increase in PD-1 expression on splenic T cells in combination groups. Chronic PD-1 expression can cause T cell exhaustion at the tumor site, but it can also be an indicator of activation. High PD-1 expression may indicate increased T cell activation when T cells did not become exhausted due to an early intervention of anti-PD-1. In comparison to non-FUS groups, FUS-treated tumors had elevated MDSC populations. MDSCs are immunosuppressive and a common mechanism employed by breast cancers to evade the immune system. In FUS monotherapy groups, we also observed a decrease in DCs and an increase in neutrophils as a percent of overall immune population. Elevated neutrophils indicate an ongoing innate wound healing response. However, in combination groups, these populations reverted to a non-FUS baseline level. Since we acquired 3D thermometry data during ablation, we also correlated thermal exposure to immune cell population differences. We computed the percent of tumor reaching lethal thermal dose and the percent of tumor exposed to a hyperthermic non-ablative temperature rise. Both of these exposure metrics were significantly greater in FUS-dense tumors. Here we look at one example of this analysis in CD8 positive T cells. CD8 positive T cells were negatively correlated with FUS thermal exposure in our FUS monotherapy groups, plotted in red. However, in our FUS combination groups, shown in green, I switched those, I'm sorry. Our FUS monotherapy group is plotted in green. In our combination groups, plotted in red, this negative correlation was reversed for hyperthermic exposure especially. And this data is separated into sparse and dense tumors. We demonstrate that these correlations were not conflated with ablation strategy applied. And since a much higher percent of the tumor experienced hypothermia in our dense ablation groups, this analysis supports the finding of increased CD8 T cells in the FUS-dense combination groups, but not observed in the FUS-sparse combination groups. Overall, these results suggest that following FUS ablation, anti-PD-1 intervention may have allowed for continued T cell activation rather than exhaustion. This is supported by slower tumor growth and higher CD8 positive T cell infiltration in our combination groups, which is also a positive prognostic marker for TNBCs. Additionally, FUS thermal monotherapy slightly reduced APC infiltration and increased MDSC and neutrophil populations. FUS combination therapy reverted some of these trends to a baseline. Finally, MR thermometry is a promising tool for characterizing these thermal exposure effects on the immune response in tumors and for optimizing thermal ablation strategies. I'd like to thank my research group at the University of Utah and all of our collaborators at the Department of Surgery and Huntsman Cancer Institute for their generous contributions to this work. Thank you for your attention.